Welcome, ladies and gentlemen. I'm Caroline Leishman, and I'm with Pebble in the Pond Environmental Society in Powell River. I want to thank everybody for coming out tonight to this coal expansion awareness meeting. I want to respectfully acknowledge that this meeting is taking place on Tla'amin First Nation traditional territory. I also want to thank the City of Powell River for gratefully giving us the space of the Evergreen Theatre to use to hold this meeting tonight, and acknowledge that a couple of the city councillors are present tonight, and as well our MLA Nicholas Simons is present. Hi. In a moment I'm going to introduce our guest speaker. First I want to mention that Owen Moriarty, a filmmaker from Vancouver, is present tonight filming the meeting. He has been covering all of the proceedings about this awareness of the coal expansion that's happening on our coast for several months, and he'll be putting together a documentary to be released within the next year. So I just want to mention there'll be a Q&A after a couple of the speakers. So if you happen to get up and ask a question and you don't want to be involved, you don't want to be on the video footage, just maybe go talk to Owen after and just mention that. So basically what we're talking about tonight is the Fraser-Surrey Docks have applied for a permit to develop a direct transfer coal facility to ship up to 8 million metric tons of coal annually. It will then be transported from Fraser-Surrey Port on open barges to Texada Island, put in large piles to then be loaded into large freighters that will be then sent to Asian markets offshore. It's about 20-time increase in what they currently export the coal. So there's definitely some questions in our community as to how that's going to impact us, the residents of Texada, the marine environment. So our guest tonight is Dr. Frank James from Washington State. He's been active in teaching, research, and medical practice for the last 20 years. His interests focus on health promotion and disease prevention. He is currently the health officer for San Juan County and health officer for the Nooksack Indian Nation. He has been a clinical assistant professor at the University of Washington School of Public Health since 1992. For a decade, he was a primary investigator for an NIH-funded cancer prevention trial at the St. Joseph Hospital Cancer Center. For over nearly 10 years, Dr. James was the medical director of Interfaith Family Health Center, a local community clinic that provides care to thousands of families on a sliding fee scale. He's been doing a lot of research in Washington about the effects of coal on the community near Cherry Point, where they have a large coal facility. So he has a lot of experience and will give basically a lot of the health impacts of the coal expansion project and how it relates to us. So I'll turn over the microphone to Dr. Frank James.
Thanks for all of you coming out tonight. I know on a Sunday night tonight is probably there's lots of other things you could be doing. I want to share the story that I have about why I'm doing what I'm doing. About 2 years ago, it became clear that there was going to be a coal port in our community. And one of our physicians, a person I very much admire, Sarah Mustad, sent out an email to several dozen of the doctors. And we read it and took some note of it. And I think the most important thing was that Sarah was somebody that we trusted. She has an MD degree from Harvard University and a PhD in epidemiology as well. And she's an infectious disease specialist, and she's the person that if our child was ill, critically ill, that's who we'd want to take care of our kid. She's that kind of person. She's also a mom, has 3 kids of her own. But she's the one that reached out to our medical community and said, I think this may be a problem. Now, she didn't say it was for sure. She said she was concerned. And about a dozen of the physicians in the community got together And it was a very diverse group, which was, I think, the strength of it. There were conservatives, there were Republicans and Democrats in our system, conservatives and progressives. There were people affiliated with the business community closely, and people that were kind of more progressive political folks that were involved very deeply in social issues. What we did was what doctors do, is we sat back and didn't do anything. We looked at the medical literature, and we reviewed 400 articles. And nobody's paying us to do this, so we did it between 9 at night and 1 o'clock in the morning. And we got together about 3 times over 2 years. Most of our work was done by ourselves at our computer at home. And what we do is we did a search of all the articles relative to coal burning and coal transportation and coal stockpiling. And we reviewed those articles one at a time in detail. Now, these are not the articles that you see published in magazines. These are scientific journal articles that have been peer-reviewed and before they were ever published. So they were ones that had some scientific rigor applied to them before they were put in print. And we kind of expected that there would be 2 piles of research. There'd be one of the things that said it was okay and fine and maybe even good, and there would be a pile that said there could be problems. But what happened was that we discovered that virtually all the articles ended up in the there's probably a problem pile. And some of the things that some of us thought were important kind of were in that pile. There were things, one of the docs was really big on noise. He said, this noise problem is a big deal. And I said, no, it's not, it can't be. Noise can't be. But as we looked at the scientific literature, we found that noise actually can be a big deal, especially for elders and especially for children. Elders woken up through the night actually have more cardiac arrhythmias. They die more frequently from heart rhythm disorders. Kids that have noise during the school day actually have a harder time learning, a significantly, measurably harder time learning. So each of us kind of got an education from their peers. We were very rigorous and stuck just to the science. And our group actually isn't for or against the cohort. What we want is an objective, independent, scientific evaluation of the data. And what we want to do, we know that people that are exposed to diesel particulate matter from the ships and from the trains, there are definite adverse impacts about that, and I'm going to talk about those in some detail. We also know that coal dust has definite impacts. What we don't know is from that specific application, from exactly where the train's going to go, exactly where it's going to be stored, how many people will be impacted and what sorts of people. So what we're calling for is what's called a health impact assessment. And a health impact assessment does exactly that. It takes the scientific literature and then applies it to a particular place and a particular population. So what we want to know is, yeah, there may be some elders that have cardiac arrhythmias related to noise exposure. How many? Is it 1? Is it 50? We know that in many cases where these facilities have been placed, kids have about twice as high a rate of asthma. Will that be true in our situation? And if so, how many kids will that involve? So that's what we're calling for, is really a scientific, rigorously applied review of the site. Now, I believe that we're very close to pushing that facility out of our community. There were 6 planned sites in Washington and Oregon. 3 of them have been abandoned. The one that's in our plan for our community is the largest. It would be the largest coal port in North America if it were built. But they haven't actually paid for the environmental impact assessment that they have to do. They're kind of holding back. I think there's some negative things coming their way that make it harder for them. One of the things that our physicians group did not want to do was simply push it out of our community and into another. As it became clear that there were substantial adverse impacts associated with it, we did not want to just say, well, we'll just hold the line and push it out of our community. So from the very beginning, 2 years ago, I traveled to Montana and gave a talk there because that's where the thing starts. And I'm here tonight with you because friends in Canada called me a couple of months ago and said, will you come up and speak at the hearing in the city of Vancouver about rezoning the city to exclude coal ports. And I've spoken 3 other times in Surrey and Delta and White Rock as well. And the reason I do that, the reason I take time away from my family and my children to come here to be with you, is that I want you to know what we know. And I want you to be prepared and informed to make decisions about what that might mean for your community. And if you feel like it's a good thing, then that's great. If you think there are substantial issues and problems and questions, then I would, that's why I'm here, is to share that information with you. The other significant issue was that as I've done those talks in Delta and Surrey and White Rock, I found out some really disturbing things. I'll admit that I'm sort of a closet Canadian, like I really love Canada. I know you all like to complain about your healthcare system, but as a physician, you've got an amazing healthcare system that really delivers to the vast majority of people in your community. You might have to wait for some elective stuff, but in America, people die because they don't have access to healthcare. I mean, for 10 years, I ran a clinic that provided care that had we not been there, people would not have gotten healthcare. Women with breast cancer that wouldn't have gotten surgery. So I have a very high regard for your country. And for that reason, I was actually dramatically shocked when I found out the lack of environmental protections you have. I mean, I take our Clean Water Act and our Clean Air Act for granted. If a corporation pollutes a body of water, we can sue them. Citizens can. And our environmental impact process is very thorough and complete. And what I discovered is that's not true in Canada. The ports down in BC, in the lower mainland, basically those ports are run by the people that benefit from them. So the people that actually need, the businesses that use that port, they're the board that runs that port, and they can make decisions about it. I think I was probably most shocked when I gave testimony at the city of Vancouver when they were considering rezoning the city to be kind of coal port free, if you will. And everybody that spoke that night spoke in favor of that rezoning, except for one person. He was a member of parliament from the eastern part of BC. And at one point he realized he was not going to get what he had come there to get. And he stood up and he became very angry and quite emotional with the city council people, and he pointed his finger at him and he said, "You can do whatever you want tonight, because the federal government will force you to have coal ports if we want you to." And he seemed quite confident about that. It was very, very sobering to me to think that people that I've come to care about and are much like the people, my family and my friends back home, could have that kind of thing happen to them. So it made me a little bit mad. Hence, I'm here. I want to do what I can to share the information we've toiled long and hard to learn about what the impacts may be for our community. So please bear with me, because some of this stuff is not entirely relevant to you, but I want you to see a bigger picture. I want you to see what it's like from where the coal is dug up to where it's transported through to where it's stored and then shipped across the ocean. And just a little bit that we're not the people that suffer the most from this coal export deal. It's actually the people in China and India, where there are no environmental protections at all. Where we have an air quality index where if it gets to 100, asthmatics are supposed to go in and lie down. And in Shenzhen and Hong Kong region on the coast, or in Beijing, it's routinely 100 to 300 every day. And on a really bad day, it can go to 700, or recently even peaked at 900, which is really incompatible with life. I mean, what's going on in China is a huge, massive natural experiment. What we know so far is that the life expectancy in China has gone down 5 years already in regions where coal-fired power plants are used, and there are a lot of those regions. And that's particularly poignant to me. I gave one of these talks, and my son came with me and he ran up, and he's obviously Chinese. My wife is from Hong Kong, and her family's from Shenzhen and Beijing. And these are not casual things for me. One of my favorite uncles in China recently had a stroke and died. And knowing that this pollution is causative for those strokes really brings it home in a way that it would not otherwise come home. I miss him still. He's a wonderful guy. So that's the introduction. I did, like my colleague, I want to thank the Native people, the First Nations whose land we're on. I work with First Nations people. In fact, the Nooksack tribe spans the border. There are Nooksacks on both sides. The Stolo people in BC and the Nooksack people in Whatcom County, where I live, are the one people. They kind of built a theoretical line between them, but they're still one nation. And what I've learned from 20 years of involvement with Native people is that they're trying to do the right thing. They have been really put behind some really big challenges, financial challenges and cultural and economic challenges that are sometimes hard to overcome. But I have to thank them and appreciate them for who they are and the profound leadership they're providing. On this issue, they're providing dramatic leadership. The reason I think we're not going to have a coal port in my county, the main reason is not the doctors or the lawyers or anybody else, is because the Lummi people have basically said, they looked at the economics of it, said this is bad for our fishing, this is bad for our shellfish, this is bad for the health of our people. And the cultural people stood up and said, this is bad for our culture. Now the proponents down there were pretty brazen. They were in a hurry, so without permits, proper permits, they went and built a 9-mile long road, they filled in wetlands, and they dug through various sites. With no permits that they should have had, and no oversight. And that's something that kind of really brought it home to the Native population. They realized that these people, and for us, it's Goldman Sachs, you've all heard of them, they're 49% partners. Berkshire Hathaway, which owns Bloomington Road and Santa Fe, which is the people who bring the coal to BC. And SSA Marine, which is the largest private operator of ports in the world. These are not inconsequential people, but they're also people that are used to getting their way and doing what they want. And I would just warn you that these are tremendously large forces that you're talking about. And I have some reservation about speaking out about it. I think there can be a negative downside for anybody that does that, and I'm doing that. So it's not inconsequential to be in opposition to people like that. The tribes have taken an unequivocal stand, and they have in our country a special status. If they object in the way the Lummi tribe has objected, typically the Army Corps of Engineers will not even process the permit that's been applied for. They won't deny it, they just won't process it. So that's what I'm hopeful about and grateful for, that the Native peoples have come forward and been our partners in the community. So thanks to the local Native people here. The main thrust of what I want to say, and again, some of this, bear with me, is that what you can see along the waterfront here is a 1.5 mile long train. Now, I love trains. We live fairly near, you can hear them, you can see them, and my son adores the Amtrak train when it comes through. Even the freight trains are nice. But these coal trains are not like that. They're dramatically heavier, they're dramatically noisier. They take 6 engines to pull them, they're so heavy, so it's not one engine, there are 6. The amount of pollution created by moving this 50 million tons of coal in and through our community is about like building a brand new freeway through town. 6 engines, and for us that would mean one train every hour of every day of the year. And so what's going on? And what may impact you? They're saying now you can go from 400,000 tons to 4 million tons, maybe 8 million tons. But honestly, that may be a dramatic underestimation of what people want to do. If we push 50 million tons out of our community, these people are still going to want to export it. The things no one tells you on the front end, it was a long time into this before I realized where the coal came from. This is coal from Montana and Wyoming. And I kind of assumed that it was owned by these companies, but it's actually sold to them by the federal government in the US. And sold to them at a dramatically reduced rate. They sell it for about $10 or $11 a ton. And they sell it in China for $125 a ton. And about $100 a ton is the expense of moving it there. If you include any of the externalized costs, any of the healthcare costs, or any of the other costs that are externalized up onto other people, it wouldn't be profitable. An at-grade improvement, that is, if you want to have the train go through without blocking the road, you build an overpass. The one in Bellingham costs about, one of them, there are 8, but the one they're thinking of redoing is $60 million. And we have a federal law that says that 90% of that cost cannot be borne by the rail yard. It has to be borne by the public. It's a federal law. So 90% of that $60 million will be paid in taxes by me and my neighbors for the privilege of not having a train going through that one intersection. So trains are a big deal where we're at, and you're not experiencing that, but know that that's how it gets here, and at great expense to other people. You can see it starts in Montana and Wyoming. Some's going to go up to Prince Rupert from Montana. Some's going to come around and down and up the coast, and then potentially stop where we are, potentially go to West Shore, potentially go from the Fraser docks up to Texada Island. Now, the really big picture doesn't stop there. The really big picture is this: is it comes from Montana, comes to the West Coast, and then goes to China. Some potentially to Korea, some potentially to India as well. Now, the people that are proponents of this, they don't want you to think about it like that. And the reason I want to talk about it like that is I think that's the real picture, the objective picture, and the truth. What they want to do is talk about things like this. They literally are arguing in court, and what they did argue in court, that the only impacts that should be allowed to be considered in allowing the permits for them to build this are within that gray and white line. No other impacts should be considered. And they, with a straight face, say that. Now, they're the same people who are going to bring it to you, so you can expect the same thing from them up here. So they don't want to talk about the trains, they don't want to talk about the ships, they don't want to talk about anything else, and they don't want any of the permitting granting agencies to talk about those things or allow those things to be considered in issuing their permits. That's their official position. It's sort of mind-boggling, isn't it? I mean, that you would even see the dock. It's got a circle all around. This is some of the richest herring herring spawning areas that there are here between the Canadian border and down into Whatcom County. And they don't want to take that into consideration. We'll talk more about that in a bit. They also don't want to take consideration of other green docks that are there or any of the other ports. They don't want to look at cumulative impacts. So something you may want to think about as a community is, do we want to look at the cumulative impacts? If there's one in Prince Rupert and there's one here and there's one in Vancouver, should all of those be dealt with separately, or should you take a larger view and consider them all together? And I can tell you from my 2 years of experience, they will do anything to make them not be considered together. That is just, that's a deal breaker for them. They will do anything to prevent that. This is what the unimproved area looks like in our area. Kind of pretty to look at, isn't it? This is what the improved would look like. Now, in all seriousness, they think that way. They think this is unimproved, and this is, and this is somehow better, right? So, in the process, you need to look at adverse impacts. There are adverse impacts from the mining, there's adverse impacts from the trains, there's adverse impacts from the storage, and there's adverse impacts from shipping across the sea. Here, I think one of the biggest issues is going to be actually the boats going in and out, and I'll talk more about that, because these are just not average ships. The last impact is the impact where it's used in India, Korea, and China, and the impacts there are very substantial. Whether it's going by a school or going by a beautiful natural area that you love, or impacting potentially irreplaceable animals. One of the biggest things that I worry about is that the coal dust that comes off of these in and of itself is relatively inert, but it goes in the water and blows off the ships. I'll show you some pictures of that in a minute. And it goes down and it falls on top of eelgrass in the area there. And when it does that, it simply forms a barrier to sunlight in the eelgrass, and the eelgrass will die. Well, it turns out the eelgrass, for those of you who are biologically inclined already know this, but eelgrass is essential because that's where the herring lay their eggs. So if the eelgrass dies, the herring dies. And if the herring die, what are the herring the main food source of? The salmon, our salmon supply. And what do the salmon feed? This critter over on the left there. Without the salmon, they're not going to survive. So you have to think holistically about this. The proponents would like you to think of Boulevard Park. This is a park in my town, and they want you to think about it like that. The red line is where the train's going to go. And actually, towards the upper end is where a train ran over and killed a young mother in our community 2 years ago. A similar train ran over and killed a young woman in a similar accident 2 weeks ago in White. But they want you to think about it like that. And honestly, that's not the right way to think about it. This is how we think about Boulevard Park. That's my friend James Wells' daughter on her 3rd birthday. These are places we love, we're involved with, we care about. It's not just a map. It's a place where people live, where they love, where they find beauty and meaning in their life. And I think that is the same as us. Just a little bit about the herring, what's happened, and what this doesn't show is there was even a larger decline before this, but all the little red dots and the size of them is how many herring are there, and this is from Point Roberts and the Canadian border down through Lummi Island, down where we live. And so you can see this is what the herring were like back in the 70s. This is what happened during the 80s. This is what happened up to 1996. And that's what happened up to 2005. Those herring are just disappearing. And that's where the post-coal time is. So this isn't theoretical. This is real data. So for us, what we're fighting against is 18 or more to add to the current trains that currently go to Canada. That would be 24 trains that are 1.6 mile long trains. Now those trains, if they lock up all the brakes, take a mile to stop. So that engineer doesn't want to run over somebody. They don't have a choice. They lock up all the brakes 1 mile for a train that heavy and that. It also means 400 ships traversing our waterways, greater than 485. Now, these ships, they're not what we think of as freighters. These are what are called, they got clever little names. They're Cape class and they're Panamax. Panamax means as big as you can fit through the Panama Canal. Sometimes they go to India, they may go that direction. And Cape class means so big that they have to go around the Cape. Now the ships that are Cape class are the largest things ever built by human beings that move. They have millions of gallons of fuel in them. They are single hull. They have the worst safety record of any vessels afloat because they're so big. That's what they want to bring here to pick up the coal. You can imagine what a few million gallons of diesel fuel would be like on the beach. Seems like a bad idea. This is the largest ferry we have in Washington State. You guys have a little bigger ferries, but that's the relative size of the ships we're talking about and the big ferries that we have. I mean, they really are surrealistic in proportion. They are, well, it sort of reminds me of a story. My son and I, he's 9, we were reading the Hobbit series, all 4 books. The Hobbit and then the 3 books about the Return of the King. And we spent 2 years reading those books, and we were kind of to the end of the last book. And you can hear the trains from my house. And my 9-year-old, one night, we were laying there, it was really quiet and nice, and you hear these trains coming. So they're really quite noisy, and kind of the wheels screech, and they're heavy, and the horn sounds. And my son looked up at me and says, "Dad, is that train from Mordor?" Those ships are, I think, too. It's sort of sobering, that kind of thought. So to talk specifically about what the health issues are, and this combines, they're waterborne, there's the coal dust, there's diesel exhaust, there's There's air and water pollution, there's increased train traffic, there's the noise, there's the delays, there's the safety issues for trips for ships and trains. I'm going to talk a little bit about the organ system, because there's respiratory, cardiovascular, and neurologic damage that can be done. With these things, there can be what's called oxidative stress. If there's any docs in the community, you're welcome to ask me more about this. What's sort of amazing is that they actually now have the research is down onto the endothelium of the heart tissue, so the vessels in your heart, they actually know how these things go in and disrupt the plaques inside the arteries, inside your heart, causing strokes and heart attacks. And they understand in great detail the mechanism. In terms of the pulmonary effects, asthma, when we first were looking at this, I'm a county health officer, so I called the jurisdictional county health officer in the county that has a current large facility exactly like this back in Virginia. And I said, how's it going? And he said, we have a puzzle here. Our asthma rates are double what the adjacent counties are, and we can't really explain that. And so I sent him some of these articles, because doubling of the asthma rate in children is exactly what you would expect. Chronic obstructive pulmonary disease, the same thing that tobacco causes, can be caused by this. Stunning lung development, so kids that grow up chronically around this can have smaller lung volumes, majorly smaller. If mortality is going to go up, and lung cancer rates are going to go up. Those are all associated with being near one place. So cardiovascular effects, arrhythmias, heart attacks, congestive heart failure. Cities that have a high pollution index, similar to the stuff that comes from these trains and ships, has about a 4 times higher death rate for ones with high versus low concentrations. And in a place that's so pristine, I was walking down the beach when I got here and saw how clear and beautiful the water is and how clean the air is. Relatively, it may make a bigger impact here because you're starting at such a pristine level. In places that are already pretty polluted, in Vancouver, they may not notice as much. In terms of the nervous system, ischemic strokes, cerebrovascular accidents, that's a stroke. There are 2 kinds. There's ones that for clots and ones that are breaking open at different kinds. And then there's actually a measured loss in intellectual capacity. And this is more true in kids than adults. Their ability to learn when their schools are near one of these train tracks or sites where they transfer the coal and the ships are, they have a measurable decrease in intellectual capacity. And just to emphasize that a little more stringently is that we want to ask for health impact assessment because we want to know who in the community is going to be impacted by this. And some people think elders, they're going to die anyway. Some people, think kids aren't important. We want to know what specifically who's going to be impacted. Is it going to be children, the elderly? It turns out that these are all the categories that we know are likely to be more impacted. So children, the elderly, people with pre-existing lung conditions, people with pre-existing heart conditions, diabetics, women over 50 are particularly prone, and workers exposed to diesel exhaust in particular. You're inclined to believe that kids are just short adults, and that's actually not true. So children, on almost all aspects of this, will be disproportionate. I'm glad none are here, because it makes me nervous saying this stuff around them. I want kids to be happy and joyful and optimistic. But they eat more, they breathe more, they drink more per body weight than adults do, and the impact of all of these is going to be greater on them than adults. Coal dust itself is associated with chronic bronchitis, emphysema, and pulmonary fibrosis. There's also mercury-laden cadmium in coal, and if that gets out of the environment, it may not immediately affect people, but once it's dissolved and goes into the water, you're going to have higher rates of those things. And interestingly, I'll talk a little more about this in a minute, but mercury, we think we've sent it to China, right? Lake Whatcom, which is the water that I drink every day, that's our reservoir in Bellingham, has elevated levels of mercury in it. In fact, they're high enough that women of childbearing age and children are not supposed to eat fish out of the lake that's my water supply. And when they studied that carefully over the past 10 years, what they found was that about 15 to 30%, they don't know exactly, but between 15 and 30%, about a fifth of the mercury that's there, comes from mainland China, from the smoke that goes up in the air, that gets into the atmosphere, that's blown over, that's deposited in our area. So we think we're shipping pollution away, but it's only one planet here. All those divisions between countries and people and stuff, that's a theory. That's an invisible line that doesn't really exist. And both infectious diseases and pollution don't know anything about those lines. Diesel particulate matter is the thing that probably worries me the most. So this would be what comes out of the smokestacks of the ships bringing it up to Texada Island and taking it away from Texada Island. And when you burn diesel, you get a carbon core, and around that carbon core are some organic compounds and sulfates and nitrates and heavy metals and other toxic substances. And the bad thing about burning diesel is that you get these particles, and the bad thing about these particles is they're 2.5 microns in size. Well, it turns out that 2.5 microns means a bigger particle will get filtered out in your upper airways. But 2.5 microns, you can see where that red line is down there, it goes all the way down to the air sac at the end of the airway and comes in direct contact with in the alveoli with your capillaries. So it takes all that toxic stuff, the metals and the toxic substances, right into contact with the bloodstream. So this is why diesel particulate matter is a significant bad actor. Because that 2.5 microns is small enough to get to the deepest part of the lung. Now, diesel particulate matter is made by trucks and boats and wood smoke and trains. There's a bunch of sources of it. What we find is that fine particle pollution, which is the diesel particulate matter, the 2.5 micron pollution, increases cardiovascular disease, increases lung cancer, increases hospitalization for asthma, decreases development of lung function in children. Now, we have articles that show each one of these, and we put them on a website. So if you think I might be wrong, I would love for you, really honestly, to go and read those articles and read our summary and see if it's wrong. And if you think it's wrong, let us know, because we'll fix it. We'll correct that. But there's a scientific article behind every one of those claims. In fact, the American Lung Association and the American Heart Association both published major reviews of this issue in 2011 because of its importance. In 2010, in our end of the Salish Sea, again, we call it Puget Sound, you call it what you call it, but it's the Salish Sea. It's one place that we all live on and love. But our part of it, diesel emissions remain the largest contributor to potential cancer risk in our region. And the baseline, before they do any of this, before they bring the trains all the way up and put the ships through the sound and all that stuff, we already subsidize the coal industry and other sources of this kind of pollution dramatically with our health and with the cost. We spend, just in our region, $190 million a year on treating those diseases that we know are caused by diesel particulate. There are some unique things we'll have that you won't have. We got the trains, so we're going to see a delay in emergency response. These trains that are 1.6 miles long are going to be across the roads. Police, fire, ambulances won't be able to get where they want to go in a timely way. And that's going to happen every hour of every day, 24 hours a day, 7 days a week. I'm glad you don't have those impacts, because they're scary. We've already had one incident where the doctor got to the hospital, the patient got to the hospital. But the guy that ran the heart-lung machine, he was 20 minutes delayed. Now, for those of you that aren't medical, we work feverishly to get 45 seconds takeoff response time. 20 minutes is like putting us back in the 1950s. I mean, those kind of delays are simply unacceptable. If some part of the medical system got that kind of delay, it would be changed in an instant. Again, 45 seconds is a long time to delay when you're talking about strokes and heart attacks, because it makes the difference in how you're going to be later on, if you're going to recover, and how much recovery you're going to have. Noise exposure, I talked about this. There is going to be noise, mostly for people who are immediately adjacent to the facility and to the transportation corridors. The mercury that I mentioned, just to get back to that briefly, mercury is a big deal. I don't like to measure mercury I've worked with Native people for a long time, and in the United States, I don't know about Canada, in the United States, Native women, about 17%, about 1 in 5, have mercury levels high enough to adversely affect the intelligence and the ability of their children, their offspring, to have fine motor coordination. 1 in 5, that's the baseline. So mercury is an incredibly toxic substance. It builds up in your body. It's not like lead. Lead you can chelate out. You can't get rid of it once it's there. It's there. It will eventually go away, but over a very prolonged period of time. Delayed learning, short attention span, memory deficit, delayed language acquisition, poor motor coordination. Is this something we want to be doing? We can feel sort of sorry for the Chinese, but not only are they going to be impacted, but we're going to be impacted by their learning this stuff. So, what the docs in my community call for is health impacts, an objective, independent, fair study. Now, we also started 2 years ago, sent this stuff to your health officers. So your provincial health officer, Randall Perry, has endorsed our call. He says we need a health impact assessment. Patricia Daly, the Vancouver Coastal Health Officer, also has called for a health impact assessment. The health officer for the southern region adjacent to where we are has also called for a health impact assessment. Currently, that has not been met with a positive response. That's sort of a nice way to say they're flipping us the finger. They don't care. And apparently they don't have to. Only if you come forward and do something will they have to. If the laws are not in your favor at all. And again, you're worse off than we are in that respect. So you've already heard some about yours. I don't know all the details, but I know that right now they're planning on bringing about going from 400,000 up to about 4 million at least, and potentially over 5 years increasing to 8 million tons the amount of coal they bring. Now, why they bring it from Vancouver to the middle of nowhere and then have to go right back by Vancouver, it doesn't make a lot of sense to me. I'm sure it makes sense to some. Now, in giving these talks, the last time I gave this talk, there was a gentleman who's an inspector, and he's not unwilling to have his name used, Mr. LeGood. And he inspects the Prince Rupert facility for coal. And these are some pictures he took, and he came to the meeting and he asked if he could share them. I said, sure. So I got his permission to use them. But these are actually the inspector that inspects the coal port facility north. This is one of the ships coming in. This is one of the smaller ships. These are pictures of the sheen of oil from the ships out on the water. This is a picture of the coal being blown off onto the surface of the water. You can see it here. So they were very moving to me to see that, because that's what the current regulation of inspectors on the job, right? This is one of the standards of USS is that something's reasonably foreseeable, that it should be avoided. This is a photograph of the West Shore facility down just south of Vancouver on a windy day. The coal dust goes about 5 kilometers on a windy day like this. So adverse impacts are things we want to avoid if they're reasonably foreseeable, if they're significant, and if they can't be mitigated. There's really only one thing to do, and that is to not do it. Now, you can all imagine if a ship with millions of gallons of fuel were to go down in the waters around here. It's not going to be an issue for the people in Vancouver as much as it will be an issue for the people here. What does that do to tourism? What does it do to the health and safety of the fish that you're used to catching and eating? The shellfish? What does it do to the community that's much nearer, might be right where this thing takes place? It can be devastating. So the uncomfortable thing I want to give to you at the end is this. I want to tell you that an activist is somebody who cannot help but fight for something. Okay, that's me, and I hope that's you. And you're not going to get power. You're not going to get money. You're not going to get fame from that. In fact, you might get the opposite of those things. But there really is, if you're driven by injustice and unfairness, you'll be called to do something about it. And honestly, I think this is the most unjust, most unfair thing I've run into in my life. It hurts so many people with so little benefit. The facility here would employ, I believe, 16 people, and people talk about jobs, jobs, jobs. If the discussion is jobs versus the environment, there's a chance that the jobs argument can win. People need jobs. But I think we need to look at the whole picture. We need to look at the health impacts and the potential health consequences, as well as in the very broadest way. And then I think we come to a very different conclusion. I mean, how many jobs is it worth if it's your child that develops asthma? I have asthma. About a year ago, I had an exacerbation of my asthma. I ended up in the hospital. I was laying in the ER, and I watched my blood pressure go from 120 to 90 to 60 to nothing. And I saw everybody in the ER running towards me, shoving tubes down my neck and into my heart so I would have blood pressure. Because I got into pneumonia and sepsis and septic shock. I can tell you from a very personal point of view, one, that cost $35,000, and two, it's really a moment of truth when you lay there and realize this is the consequence from bad choices. And that happens to lots of people. So I'm calling on you to be an activist. I'm asking you to do something. Now, what you do may be by letter. What you do may be to join a pebble in the pond and get the program going in a much bigger way. It really doesn't matter. You got the right size is the size that's going to fit you and what you've got time for and what you've got the ability in and what you can do. Some people make donations to things. That's a good thing too, if you don't have time. But I came here because this is a personal issue for me. And I think it's a personal issue for you. It may not be a personal issue right now, but I can tell you if this comes to your community, to your area, it's going to become a personal issue. Not to be too serious, I think one thing for last, I just ran into this today. Apparently it's been around for a while, but I love it. Visit Montana's Riviera Record. See that? Just follow the sound of coffee. So you gotta have a little bit of humor. Okay, I'm happy to answer questions whenever you'd like me to answer questions, or if we have any questions, I'm happy to wait for it on.
Thank you. Let's give Frank and I a round of applause. Thank you so much.